Alex, do doctors save lives?
Yeah.
They do. Okay. In a situation like that, in a crisis, in a crash, is a doctor usually there? No. So do nurses save lives? Yeah. Do nurses' assistants save lives? Yeah, they do, because they push buttons. They're watching and observing when the nurse is not there. So who is more hands-on? The assistant, the nurse, the doctor. I would say first the assistant, then the nurse. So, do nurses save lives? Do they make judgment calls? Do they critically think? Yes, all day long. Do they have your life in their hands? Yes, in all departments. Do nurses get mistreated? Maybe you don't know. They get mistreated terribly. They get abused verbally. They get abused physically. I can tell you of events where patients have swung at me. You know, and that was before I was graduated from school. That was in my clinicals. They are mistreated. Not all the time. Let's not generalize. But verbally abused, not appreciated for generally. So all of my nurse associate friends are always publicizing on public media about how they feel unappreciated. And it's something to think about next time you're in the hospital or anything else. You know, that nurse, you may thank that nurse that, well, I love that nurse because they saved my life. My sister said it 3 times. You know, I had a nurse that was great when I had my obstruction. Many people owe their lives to nurses and doctors. It just depends on what moment, you know, who's present and how they help. So, are nurses appreciated as much as they ought to be in general? General. No. But specifically, you may find people that say, I owe my life to that nurse. I mean, let's talk about body fluids. We are pooped on, peed on, we're swung at with the pediatrics in the trach. There's a term called shotgun, which means that patient sneezes and blows out secretions out that hole and it hits you in the face. That's called shotgun. We're spat upon. Sometimes we have to look through the patient's poop. Sometimes we have to take culture samples. Sometimes we have to take culture samples of saliva. You know, they say that as much as construction workers, nurses are propense to have back injuries because we're moving people off the center of gravity. You suffer the chance of being mistreated. You suffer the chance of having your patients die, and you love them as much as you love your children. You suffer the chance of being abused by family members who are not happy with themselves, therefore they take it out on you because of the condition of their child. You're not only dealing with a patient, and I'm speaking about home health care pediatrics, you're also dealing indirectly with family dynamics. I can tell you I've been in homes where it was unbearable because you're trying to take care of the patient and they are screaming and shrieking and fighting on a daily basis. And you're there and they don't care. You know, I've seen all kinds of stuff. You know, nurses have a hard job. And do I think that they're compensated enough? not unless they have their master's or their bachelor's. But the nurse on the front line, how do you compensate when somebody's life's in your hand? How do you put a price on that, a compensation? It's a tough job. It's like being a policeman. They have it. I mean, those guys, they have a tough job. So nurses do too. It just depends on where they're working. They see trauma all the time. They see death all the time. I've helped people die. Not helped them, but been with them. Do you think that's easy? No. So, there you go.